Hi, it's Dr. Kate, and today's episode of the podcast, I'm going to talk about intra-abdominal pressure and how that looks for you in a variety of different ways. What can it affect? A lot of times, women struggle to find that optimal pressurization in their abdomen at postpartum. And it can happen even, if you didn't have a C-section or if you did have a C-section, that there's that difficulty reestablishing good, proper intra-abdominal pressure. And that gives us those common symptoms that you think of when you think of postpartum. So leakage, peeing ourselves when we cough or sneeze, or do a heavy lift when we get back into heavy lifting or cardio, those kind of things. But we could also have poor intra-abdominal pressure engagement when we've had different lifestyle things that have created a improper pattern happen in our life. So that could look like a desk job where you're rounded over and we're stressed and we're breathing with these little accessory muscles in our neck. So what kind of things does this improper pressurization of our abdomen cause? So if we're thinking pressure problems, we're thinking diastasis recti, because if you have an imbalance in pressure and we have that opening in the front line of the midsection, we just did another podcast on why different exercises don't always work for healing diastasis recti, because it can look different. It can be at different levels of that midline section. It can be wider or rather than deep, or deeper rather than wide. It just depends on what exactly is happening. Another type of pressurization problem would be pelvic floor dysfunction. If you don't have that symmetrical pressurization in the core, then you might have too much pressure right down on your pelvic floor, causing things like incontinence, fecal incontinence, pain with sex, those kind of things. Then we also could, in that same pelvic floor region, we could have prolapse. And prolapse shows up in a variety of different ways, and there are different degrees of prolapse. Sometimes prolapse requires surgery. Sometimes prolapse can be made better or have relief with exercise and learning to monitor that intra-abdominal pressure a little bit better. So prolapse, if you don't know what prolapse is, would be something dropping down from into the past the pelvic floor and into the vaginal wall. So if you have prolapse of the bladder, that would be one form of prolapse. You could have your literal uterus coming down and descending into the vaginal area, or you could have a rectocele, which would be the rectum prolapsing through the vaginal wall. So not an easy way, but one easier way to make yourself more susceptible to have a prolapse while pregnant would be straining to poop. And I think that as soon as you are pregnant and you have your first visit with your OBGYN, they should say, like, warning sign. Constipation is sometimes a side effect of pregnancy, and they don't tell you right out of the gate usually. Do not strain while you're trying to go to the bathroom. You can give yourself a prolapse pretty easily, because people can develop prolapses even when they're not pregnant, and that could be from straining and chronic constipation. That alone can cause prolapse, and you're even more susceptible to it with pregnancy because of ligament laxity and other things like that. So right out of the gate, pregnant or not pregnant, do not strain when you're trying to go to the bathroom. There's different tips and tricks you can try to do to help with going to the bathroom. And I wouldn't say, just as a blanket statement, just take in more fiber, because sometimes once you hit that tipping point of too much fiber can then switch gears and actually cause more constipation. So increasing our water intake, consulting with our doctor and seeing if we can take a magnesium supplement. You always want to clear that with them first, but sometimes mindful use of magnesium supplements can help with constipation. So that is important for both pregnant and non-pregnant. Stop straining when you go to the bathroom. Now, some physical things you can do to help with constipation would be diaphragmatic breathing. I know you're going to think like I think breathing is the answer to all of your problems, but when you're thinking about the motility of your intestines, learning how to engage your diaphragm is an important role of that, because when you get that dome-shaped diaphragm to flatten down and push all your abdominal contents down, that's going to shift your organs, including your intestines, down, a few centimeters, let them come back up and down and up, and it keeps them more mobile. It reduces the risk of adhesions within that area. It keeps your lymph system going really well, and that decreases inflammation. And it helps it be better vascularized. So vascularized is blood flow. We want good blood flow. We want good blood flow to our pelvic floor. We want good blood flow to our intestines. That keeps us regular. So learning how to breathe properly, getting that rib cage expansion, and working on your intra-abdominal pressure is going to help with regularity. And that is going to help with reducing the need to strain and reducing your risk of prolapse. So breathing is great for motility of the intestines. And then you can also use your Coregeous ball, one of my favorite tools. And that is that little Pilates ball. It's blow up. You can have it all the way inflated for a really intense abdominal massage, or you can make it about pancake size so that it's not very intense, super gentle on your intestines, and you can lightly do the area, work on the sides, and then gently shift into the abdomen. And I actually also posted in my YouTube channel a digestion aid exercise that actually kind of uses some acupuncture points to help stimulate digestion. I'll link that below. It is very easy, and I actually use the smaller yoga tune-up balls. So they're about the size of a tennis ball. So you could use a tennis ball as well. I like the tune-up balls better because they have some give to them and a little spring back. But you could use the tennis balls too. So there's also that to help with digestion aid. Now, abdominal massage and the tune-up balls are not going to be an option when you're at a certain level of pregnancy. So really won't be accessible to my pregnant patients, but you can do the breathing, which is always recommended for pregnant patients, and drinking more water, and the possible collaboration with your provider about some magnesium supplementation, and moving yourself helps with constipation. So constipation is, I think, people underestimate how easy that is to give you prolapse, especially during pregnancy. The other thing is when you're on the toilet. There is a part of your pelvic floor that kind of acts like a lasso around your rectum. And when you are going to the bathroom and your feet are all the way down on the ground, that lasso is pulling up on the rectum and it's not letting it relax fully. So I would use a squatty potty, which if you don't know what that is, it's just like a little stool for your feet. It doesn't have to be fancy. I have one in every bathroom in my house and at the office. If you don't want a prolapse or, another thing that is a pressure issue involving similar area would be hemorrhoids. And lots of my pregnant patients get hemorrhoids. And that is also, made worse by straining. So get yourself a squatty potty or a stool, prop your feet up so that the knees are higher, and breathe and try to relax your pelvic floor while you're trying to go to the bathroom. And then reach under your butt and grab underneath the bone that you sit on and pull this cheek out to one side, pull the other cheek out to the side, do some pelvic rocks, rock back, rock forward, shift side to side, get some movement while you're literally on the toilet. It sounds bizarre. You don't have to do it in front of anyone, so who cares what you look like on the toilet? But really try to avoid straining. I couldn't say that enough, and I wish that I could. Usually by the time someone comes in to see me when they're pregnant, they're already a little further into the pregnancy. But I wish that I could get that message across even earlier to people to not strain when they're going to the bathroom, pregnant or not pregnant. So we've got that pressure problem. We've got the pelvic floor issues. We've got diastasis recti pressure problem. We've got prolapse pressure problem. We've got hemorrhoids pressure problem. You could even get varicose veins, would be bulging or distension of the veins in your labia. So that is also a pressure related issue. Another thing that besides the straining, that it creates a lot of excess pressure when we're pregnant or otherwise, would be getting sick, where we're sneezing all the time or coughing all the time. That creates a lot of pressure, and that is, constipation. We can control that and, do things to help with it. With getting sick and having the sneezing and the coughing and that kind of thing, we really can't stop ourselves. It's more involuntary, and you just kind of have to ride it out. But trying to do the best you can, maybe putting some pressure on that front line of your linea alba when you're coughing and sneezing to give it a little bit of support when you are having a sneezing fit, that kind of thing. And if you're having like varicosities or those veins that are distended in your labia, putting pressure there when you're coughing or sneezing. If you develop those, they make certain like garments that put pressure on them, which are probably, not the most user friendly to put on, wear, use. You can use, ice pack to help calm that area down, that kind of thing. The other pressure issues that you can have would be hernias. So people can sometimes get umbilical hernias. They can get inguinal hernias. They can get hiatal hernias. Anything with the word hernia in it is a pressure problem. And that is not limited to just pregnancy. We see it in pregnancy, but we also see it in our male patients, in our non-pregnant patients. And that would be, male patients tend to really be susceptible to inguinal hernias. And that would be, right along the crease of where your leg meets your torso. That is also a pressure issue. And that's why people tend to get them when they lift something too heavy. They aren't managing their gut pressure or their intra-abdominal pressure well, and the body will find a place to stick that pressure, even if it means herniating something. The other pressure issue that kind of ties in with pressure in the core would be disc herniations, which I don't think people tie into pregnancy or anything like that, but I was in one of my very first dynamic neuromuscular stabilization courses, and it's based out of Prague, and they treat people. If you're not a surgical candidate and you come in to one of their practices and you have a disc herniation, they treat you by teaching you how to breathe better and how to regulate your intra-abdominal pressure. Because if you think of the disc between the vertebral bodies and you've got a herniation, and you don't have symmetrical pressure from the inside, and it's putting unequal pressure, it's going to irritate that herniation. It's putting more pressure on it. And they showed us, usually in the US, you get an MRI done and you're lying down and non-weight bearing, and you get your MRI done and it shows a herniation or doesn't, whatever. We saw an MRI taken with movement. So this person was weight bearing and they were doing a squat, and it was an MRI of that. And you could see that when they were not squatting and load bearing, they had no disc herniation. When they went to do a squat with improper intra-abdominal pressure, the herniation bulged right out and then sucked back in. And I think that's so telling to how we should treat it, but also how often it probably is missed by getting an MRI done when you're lying down and non-weight bearing. Because if you're not having the pain lying down and not weight bearing, and you're not doing the provocative movement that brings it on, how do we expect to see the full picture? So, I mean, I don't think it would make you a candidate for, it doesn't make you a candidate for surgery, because in surgery you're lying down and on weight bearing. And if there's nothing to do a discectomy on, then there you have it. But it makes you realize the power of getting strong, learning how to breathe better, and managing your intra-abdominal pressure better. So that is the other pressure issue, and why we try to get people to do breathing, even though breathing seems so mundane and so boring. But that's the first step at learning to manage your intra-abdominal pressure better. And that's going to make us move better, be less, have less pain. And for pregnancy, it's going to help you decrease your risk of hemorrhoids, prolapse, diastasis recti, all of those things. But for someone that's healthy, it's going to make you perform better. It's going to make you a better athlete. It's going to make you have better body awareness, that kind of thing. So the intra-abdominal pressure not only helps to heal you, but is also good to learn to help prevent issues from occurring, because it's way easier to tell someone ahead of time, don't strain when you go to the bathroom, so that we can prevent a prolapse, rather than try to heal it after it's already happened. So I think I would love to see not just the prenatal world and postpartum, but all for everyone, get that shift over to prehab type exercises, where we're cutting off the problem at the pass instead of letting it develop into something that's going to take us a long time to recover from. So if you have any questions about intra-abdominal pressure, let me know. And I will link some of the breathing exercises from the YouTube channel below, so you can see what I mean by intra-abdominal pressure and 360-degree breathing, because that is the starting point of learning how to get that symmetrical intra-abdominal pressure. Have a good one.